Good afternoon. It is Saturday, November 8th, 2014. My name is Scott Spicer. I'm here broadcasting live on Google Hangouts for the Spicer Show, where we talk about prevention, politics, and today's culture. Today's show is focused on prevention with two special guests, Mr. Oryx Cohen of Massachusetts and Miss Thalia Begun here in Portland, Oregon. My name's Scott. I'm your host, broadcasting live from North Star Clubhouse here in Suite B in Portland, Oregon. So I had a chance to think a little bit about today's theme, building communities that embrace wellness. And on this show, we started we, being me, myself, and I, started in fall 2009 with this concept of doing a talk radio show. I modeled myself after a independent talk radio host that I had found online as I was getting into social networking and social media. And at that time, I was working in prevention. I had worked in the San Francisco Bay Area as a prevention coordinator, doing community organizing with youth for a nonprofit, and focused on local public policy change and underage drinking prevention. And so when I was doing the show, I had just moved to Michigan. I worked at a university. And so my whole thing was about public health and prevention, and that's what I was doing in my career. So this, coming back around to today, and as I kind of progressed forward in my career, around the time that I started the show and shortly after, I started working in mental health. And so for about the past 5 years, I worked in the mental health field in recovery-based programs and services. So, when I talk about prevention, it is a broad scope. And my experience over the past 5 years from a public health kind of training and education background and starting my career in prevention, I want to focus on the broad scope of issues. And in particular, with the folks who are on here today, we are going to talk about mental health. And I think mental health is a very relevant topic in general today, especially in the United States with the current culture and climate as it relates to concerns we have about violence and safety and public perception of mental health and mental illness, and this kind of wave that's happened over the past 10 years in the mental health system of employing people who identify as having lived experience with mental health issues as peer support specialists, peer supporters, wellness specialists in a variety of capacities across the country to provide people with that one-on-one mutual support that gives folks an opportunity to live the life that they want for themselves. And that's what mental health recovery is really about. And so we talk about building communities that embrace wellness. I want to kind of delve into some of the societal issues as it relates to wellness, in particular with mental health, bring in that prevention focus to talk about how we can identify problems and create solutions and work together as communities to embrace choice, freedom, dignity, respect for people's individual human rights, and kind of looking at how we support a community-based system that embraces wellness in the holistic sense. So that's kind of what I want to get into today. In terms of kind of relevant topics happening in America, across the country, I think prevention is something that's kind of translatable in all environments. And so we talk about wellness and building communities that embrace wellness. I want to get into some discussion with my guests about some models that are out there that really embrace wellness on the kind of one-on-one mutual support level, but that also foster communities which are supportive of people from a variety of different backgrounds. And I think that that's what really helps to reinforce this aspect of prevention. A lot of folks in the prevention field talk about the kind of upstream approach. So you can catch problems heading downstream as they're popping up and work to identify those solutions before they get all the way down to this big kind of puddle of chaos that could happen. So, and there's so many different areas within public health that that could apply to, and there's a lot of different areas within mental health nowadays that this topic of much kind of debate and concern and discussion in American society becomes one that seems to branch off into a lot of different areas, but there's a lot of false perception. So we talk about like people automatically link violence to a person who is mentally unstable. And if you read the statistics, you know that people with the mental health diagnosis are more likely to be victims of crimes than they are to be perpetrators of crimes. So there is no clear evidence or statistical link between violence and mental health. There's a small, very small percentage, like 2 to 4% of people who have been diagnosed with a mental health condition that are or have been, are likely to or have been violent at one point or another. But most violent crimes involve people under the influence of substances. So it's not necessarily someone who's unhealthy mentally at that time because of a diagnosis. It may be because of a variety of other factors, whether it relates to using or abusing drugs or alcohol, other kinds of situations that really have nothing to do with mental health diagnosis. When we talk about preventing violence, it's not about addressing mental health concerns in the broader sense. It's more of a societal issue, it's a cultural issue, it's very kind of complex. I think what's important within the context of mental health, when you talk about prevention, though, is really this idea of early intervention in a sense that if someone is under some type of emotional distress, we all go through emotional distress at some point in our life. We all experience some event of loss or some type of traumatic circumstance. It could be job loss, relationship loss, a death in the family, some kind of tragic accident that happens. That affects your mental health, right? So this idea of wellness is something that really applies to everybody. If we can establish a lifestyle within the parameters of the way in which we operate or where we fit in society. So like setting these ideals of in order to stay healthy, you have to be able to afford a gym membership. Some people can't afford gym memberships, so they can become physically active in a lot of different ways. We have these kind of standards in our society that to be healthy and well, you have to fit within a certain category and it's going to cost you money. And only these particular subsets or groups of society have access to these things that allow them to meet those American ideals. And I think that's something that sets us up for failure, just like how our healthcare system has been up until recent years, where unless you could afford to get health insurance and you were maybe empowered enough to learn how to navigate the system and actually work with your doctors instead of doing what the doctor said without even really knowing what they're recommending to you, then you would have a better chance of being healthy. And if you were living in poverty, you could get health insurance, but then at the same time, if you had limited income, what can you afford when you go to the grocery store? All the crap that's the cheapest prices that makes you unhealthy. And so, that's what I'm talking about, in terms of prevention is how do we identify problems early on and find effective ways to address them? And when it comes to mental health, it's a lot more complicated because a lot of times people can end up in a situation where they've experienced some kind of trauma and they're having an emotional distress, and sometimes it presents itself as can be very extreme. And there's a lot of factors involved in those situations. So if someone is hearing voices, seeing things, hearing things, they're hearing things in their head that are telling them to do things to themselves or others. It's a scary thing for that individual, and it can be even more distressing for the individual than it is to people who have this perception that being mentally unstable makes you likely to do something really horrible to someone else or that you're less of a person. And so then when people get treated for emotional distress, um, there's a preventive factor that needs to happen to where maybe going to a hospital short term and taking medication could help. But do you really need the kind of medication they use to treat extreme emotional distress for the long term? No, because these medications have shown to be the cause of obesity and a whole variety of other chronic illnesses that are now really the reason why people have been diagnosed and treated for what they call a severe mental illness are more likely to die 25 years earlier than the rest of the population. So that's what I want to get into, is how do we actually develop programs in society and establish support within communities that embrace wellness, regardless of whether it has to, regardless of the health condition, whether it's mental health, physical health, emotional well-being, physical fitness, all these different things. That's really, I think, what prevention is about, and that's what building communities that embrace wellness is about. So that's what we're here to talk about today on the Spicer Show, live on Google Hangouts. We have our guest. Okay, we're back. This is Scott on the Spicer Show. I actually just said we're on Blog Talk Radio because I'm so used to that, but we're here on Google Hangouts live. It's about 1:37 Pacific time. Okay, we're definitely having technical difficulties. I thought it would be better this week than it was last week, but we're still kind of trying to figure stuff out. So Thalia is not on her own computer screen, but she's here in our studio over at North Star Clubhouse here in Portland, Oregon. So I think I'm just going to invite Thalia to come around in front of my screen, and we'll continue the conversation. So, I think Oryx brought up some really good points in that segment, kind of talking about the epidemic of mental illness culture. So here we go. Thalia's here. Hi, Thalia.
Hello.
So I guess I want to kind of hear from, introduce yourself and talk about kind of what you do, where you're coming from, and we can continue the discussion.
Okay, sounds like a plan. And thank you, Scott, for having me on.
You're welcome.
Hi. So my name is Thalia, and I came up in Arizona, in Mesa, Arizona, and I had the fortune, which I now recognize as misfortune, of being diagnosed at a pretty young age, at a time when I would say that I didn't have any power. I was told that I had a chemical imbalance and that I would be on medication for eternity. And, that didn't sit with me right. And the reason for me going to therapy was very specific to behavior that was happening. And I think what I'm learning throughout my process and throughout my experience of learning other people's stories is that that's actually a pretty common thread. And I think the term behavioral health has a connotation of punishment, and I think that it implies that it puts all the onus on the person who is receiving the treatment without giving hope.
Yeah. Interesting.
I also think it's negative reinforcement. So the person comes in right off the bat with a self-identified label of shame that is absolutely contagious within the environment of the treatment that's being provided, so-called treatment that's being provided. Right. I think the roles become self-defining, and the power and helplessness that's experienced by a person in a current system has to do with authority manifesting as expertise, when I think the reality is that a healthy individual trusts his or herself.
Right. Wow. Okay. So that's a really, I like that perspective, and I think like a couple questions come to mind, and I think it relates again to this topic of prevention. How do we prevent people from being stuck in this kind of mental illness diagnosis? Medication is the only way to treat symptoms, and it's necessary in order to stay well and to remain stable. And we talk about symptoms and all these things, like, within the context of the medical model or biomedicine, there's some kind of merit in that treating a particular condition, which is based on a problem affecting the person, is can be managed by tracking and understanding what your symptoms are, and then identifying whether it's through the intervention of prescription medication or other medical recommendations as to ways that you can manage those quote unquote symptoms. And so I guess, one of the things that come to mind for me is I hear a lot of people say, like, there's varying perspectives where it's like, if you've been diagnosed with a mental health condition or any other like serious health condition, some people will say getting that diagnosis felt like a death sentence. And other people will say that they felt so glad they finally got a diagnosis because they could identify what the problem was, and they could work on finding ways to fix it or to address it or to manage it or to whatever. So I think, in terms of the context for what we're talking about today, like, how do you find that balance to where, like, people clearly as human beings experience trauma and distress, and there's many sources of that, and for you with your background in neuroscience, that there's an element of brain chemistry involved in that, right? And there's a lot of people who've had brain damage through a variety of incidents that have affected their behavior and ultimately their mental health, and they get misdiagnosed with particular mental health disorders that have proven treatments with psychotropic medications to stabilize the brain activity, which has an impact on your physical behavior or physical functioning, yet it still doesn't address the other underlying issues which medication has no part in terms of your emotional well-being.
I think as far as the medication goes, the difficulty is that diagnosis is dependent, medication is dependent on diagnosis. Mm-hmm. And I think that diagnosis itself is labeling, and I think that if a person is to go back and look at what the DSM is doing, it's actually pointing out symptoms or external behaviors. Mm-hmm. I think emotional experiences are often internal. I think communicating what's going on when an individual is vulnerable is something that isn't necessarily a sign of weakness or a sign that the person's distress is coming from a lack of strength. Mm-hmm. Mm-hmm. I think as far as medication goes, those medications were designed at a time when very little was known about the biochemistry of the brain. Not only the biochemistry of the brain, but the mechanisms that control healing specifically. Mm-hmm. I think a trauma medicine or a biomedicine system doesn't look at the link between environment and healing. It doesn't look at the social factors involved in healing. Mm-hmm. And it doesn't look at the role of emotion in who we are as people and individuals. Mm-hmm. It comes out of a categorization, not an individualized perspective.
Yeah, so I think it's a good point. And I think, from my perspective, the reality is, when we're talking about prevention, is how do we prevent a person receiving a diagnosis mm-hmm. from being pigeonholed to their managing their life as dependent on the ability to effectively treat that diagnosis, because that's part of the mm-hmm. problem, is that there's a spectrum within everything, and recovery is possible, but we still haven't embraced the idea that someone can recover from a mental health diagnosis. People can recover from cancer. People, in many cases, can recover from diabetes, even if they had a genetic predisposition mm-hmm. or they're diagnosed with type 1 diabetes. Yet you can't recover from a mental health condition necessarily unless you're empowered enough as a person to say, I'm going to define what my own recovery means to me, and I'm going to shape that process. And if I choose to work with a doctor at certain points in my recovery journey, I will, but I'm not going to let having had that diagnosis and receiving some type of psychiatric treatment pigeonhole me into believing that if I'm not receiving psychiatric treatment, I'm not in recovery, and therefore I still have this diagnosis that's being untreated. And so I guess that's what, I think is important to get into, and also just to talk about, like, how do we actually put that into practice? And we've been, working on that as a community and as a society and within the mental health system, but we don't have it right yet. And I think there's certain things that are missing, and there's a lot of barriers involved with, yes, doing things that work. So Thalia is going to talk more on this issue when we get back from our musical break here with music from DJ Swagg out of Washington, D.C. He mixed these beats specifically for this show, and hopefully we'll be able to do the same for other shows. So I can't remember if I'm repeating certain songs or something, but I want to give folks a break. Obviously, we only have one viewer online, so we're going to sit and think for a minute and mix it up a little bit with some beats from DJ Swagg. So we will be back momentarily. I'm going to turn... You're on the Spicer Show, watching the Spicers live on Google Hangouts. And here we go. All right, we're back. This is Scott on the Spicer Show here live on Google Hangouts. I'm here with Miss Thalia Begun. We're in Portland, Oregon on this nice Saturday, November 8th. We actually have good weather today. It's kind of dry out and a little bit of sunshine. So that's the big question now. Putting recovery in the kind of mutually supportive, non-medical model, illness diagnosis based approach, so that we can prevent folks from really believing or falling into the trap that if you've been diagnosed with a mental health condition, the only way to effectively treat it is through medication, psychiatry. And here, let me just say one thing though. I'm not discouraging anybody from seeking out psychiatric treatment. I do see that there is merit in it, and many folks will say that they feel like they depend on medication in order to stay well, or it's a very important part of their recovery. And I don't want to place any judgment on anybody who chooses that path. I myself have, and may continue to throughout time. But I will also continue to say that recovery isn't possible unless we are able to take steps in our everyday life towards wellness that go far beyond a doctor's office and a medication, and really focus on day-to-day living that promotes wellness and inclusion. I think that's a big challenge, is that when folks have been diagnosed with a mental health condition and they're told certain things about their limitations that society also places upon them, they can tend to believe that it's not possible for them to live a normal life. And there's a lot of folks who have mental health diagnoses that don't live normal lives and actually do great things in this country and around the world. So that's the idea of, like, how do we put this into practice with where our current system is, and the opportunities we have within this realm of peer support and what we kind of talked about a little bit with Oryx about peer-run respite and emotional CPR and things along those lines. So Thalia, you had something to say about that.
No, and I do appreciate what Oryx had to say about the peer-run respite. The piece that strikes home to me is the piece about empowerment. It's that a person has a voice in whatever so-called care, treatment, healing, or wellness they are a part of from day one. So nothing is so-called prescribed without a really clear understanding that that initiative is coming from the peer.
Mm-hmm.
And that the dialogue that's happening happens in an equal power basis with any provider.
Mm-hmm.
I think a healthy medical system, it's not just about prevention, it's also about the type of relationships that are being created with the so-called professionals that are being there.
Yeah.
I mean, I think the way to look at it is, a person is an expert on his or her self, the same way that a professional is carrying a body of knowledge and a set of skills and experience. Don't put others on a pedestal right off the bat, because the problem with that is that it knocks another person down.
Yeah.
And I think the system, as it is designed, has a lot of little flaws. And I think a system redesign would literally look at what is healing and wellness from the beginning. And I do think creativity is extremely important. I think rigid approaches to dealing with people necessarily prevent hearing what actually resonates with an individual for him or herself. I mean, for somebody, going running is going to be far more helpful than taking antidepressants. For another person, antipsychotics may have helped with hallucinations and voice hearing, but for another person, it may be that learning meditation is something that is just as effective as that. So I think as far as a system level goes, there are a lot of people that have been so-called programmed to see themselves as patients. I think that label in and of itself is harmful. I think that the system that exists now is largely East Coast as far as all the strength around national recovery and a lot of the dialogues that are happening with folks that are coming up that are immediately exposed to the peer options. They're immediately exposed to the concept of peer wellness and peer sports specialists. I think that the ideal system would be, as soon as somebody has any kind of emotional distress, needs support, is displaying vulnerability, that conversation is had right off the bat with that person. That people get better from this. You don't have to give up on your dreams. You may not know what you want to do right now, because crisis is pretty intense and it puts us in that sort of reptile brain where it's really hard to think about the long term.
Yeah.
And honestly, it's hard to think about the long term for a lot of people in a lot of situations. If people have dealt with oppression, if people have dealt with a lot of shame or judgment or bullying, or if they feel like being vulnerable and asking for help and support is not something that's culturally acceptable.
Yeah, right. Okay, so that's a good point. When you say culturally acceptable, I think we have to set certain standards to say there's a line that needs to be drawn within the scope of mental health treatment where certain things are not acceptable. And I think the hardest part is this basis of denial that, okay, so now we say people who have been diagnosed with a severe mental illness are die 25 years earlier than the rest of the population. What are we doing about that? We're just scaring ourselves into thinking that like having that diagnosis is a death sentence? How are we actually fixing it? How are we actually addressing the problem associated with that? And people, in our community talk a lot about the problems of the pharmaceutical industry kind of corrupting medical care and psychiatry. But we know we don't have a lot of power, right? We can stand up to these issues and we can present specific cases where people have been harmed. And I think like part of the challenge is working within the medical model has its barriers as well. So like if people are exposed to recovery as soon as they seek treatment or seek help, that can be empowering for the individual. But then it's like, okay, what resources are out there for people to actually continue to have that support so that they can pursue recovery? And I think that's kind of what's missing. And at what level does it happen? So should people know and feel like they can access support prior to entering into or seeking out medical care or treatment for their mental health challenges? And how do they go about it? So like these are a lot of good questions for people to think about, to do more research on. There are a lot of programs and services out there. I think there is a lot happening in the East Coast. And one of the things that comes to mind for me too, though, is that it's hard to really just identify because it's so complex. But so if you think about like within the public mental health system and the advent of the role of persons in recovery as a workforce of individuals who provide that formal support to folks who are seeking help or receiving services within the mental health system, and it has had a real significant value or outcome towards supporting people to be independent and to work and to go to school and to live on their own, and all these things that we think are like they're basic human rights, right? We all have the right to a free education within our public school system. We all have the right to work at the age of 16. You know, at 18, you have the right to live independently, and so you can have your own apartment because you can get a job and you can go to school and all these kinds of things. And it's like it's almost like a novelty.
So Scott, to answer your question, those are the things that are not acceptable within any kind of system framework. Is taking away the basic human rights, the so-called rites of passage that we count on to identify us as being citizens and as being free people.
Right. And so that's the thing, is like, should people have to access some kind of formal system in order to seek care because they're so afraid that having these extreme emotional states or particular symptoms are going to cause them to, you know, fall apart? Because then you get all these fears like, oh my gosh, I could become like this person I've seen in the movies. It's like that fear of mental health, like that, but it's like the fear of mental illness. And so that mental illness culture that we excuse me, we promoted, that any kind of thoughts or behaviors or impulses out of the norm must mean you have a mental health problem, kind of really leads people off into a path where they can really give up on themselves, and people around them also tend to give up. And so that's the thing. How do we prevent that from happening? That if someone is experiencing a crisis, they should know that there's somewhere they can go to talk to another human being and get support, and not feel like they have to go to an ER to get medication that can be addictive and harmful and detrimental, you know, in the long term to your health, because that's not an effective short-term solution. And so, you know, talk about the issues with people being able to access one-on-one support. And so like therapy, talk therapy works for a lot of people, but it's not accessible. It's too expensive. You know, most insurance plans don't provide full coverage and all these different things. So it's like this idea of having places where people can go that are at no cost to them, and all it takes is a phone call for someone to disclose and say, I'm experiencing a crisis, I need support, can I come over and stay for a couple nights? Or to walk into a building and say, I'm not feeling well today, but I need to be around other people and I want to feel free and without judgment to just listen sometimes, you know. And so that's what places like North Star here in Portland really promote. Yet this clubhouse model that North Star is a part of does not always promote recovery in other settings. And so that's, I think the challenge is a lot of it's like, where's the funding coming from? Who's behind it? Is it really promoting recovery, wellness, and inclusion, or is it reinforcing a lot of the negative stereotypes, stigma, and discrimination we have towards disability? Really, it goes beyond mental health. It's the spectrum of people from differing life backgrounds and experiences and ways of functioning physically and mentally that are maybe supported but not accepted, and kind of treated in isolation. So we talked about a lot of great things today. It's almost 2 o'clock. I'm going to leave us with some more music from DJ Swagg, and this is the Spicer Show on Google Hangouts Live. Thalia, thank you so much for joining me today.
No problem.
It's been great, and we'll see if we can address some of these technological challenges in future episodes. So we're good. The show's going to be running hopefully through December 13th. Next week, the focus is on today's culture. The Spicer Show focuses on prevention, politics, and today's culture. And thanks, everybody. Hope you can tune in next week between 1 and 2 p.m. Pacific time, 4 to 5 p.m. Eastern time. Thanks a lot.